So atrial fibrillation is a problem when your heart or the top part of your heart or your atria is beating very, very fast. And one of the major problems in having atrial fibrillation is that you are at risk for your blood clotting in your heart, which can eventually cause a stroke. So we know that thinning your blood protects an individual from this devastating endpoint of stroke. There are two general classes of medications that are very beneficial in preventing stroke: blood thinners or anticoagulants, or antiplatelet drugs, drugs that are targeting the platelet, such as aspirin. Now we know that anticoagulants are much better at protecting against stroke. So warfarin or Coumadin or some of the newer drugs like Pradaxa, apixaban, or rivaroxaban, those are very effective at lowering the risk of stroke. Antiplatelet therapy drugs such as aspirin or clopidogrel, while very effective in reducing the risk of heart attacks, are not as good as anticoagulants in lessening the risk of stroke. Now, certain people use one or the other, or they tend to use both. I believe that if somebody has atrial fibrillation, they should really, for the majority of patients, should be on an anticoagulant and not be on an antiplatelet unless there's a very strong indication. Because antiplatelet therapy targets the platelet, and the platelet is responsible for clotting. So when you are on an antiplatelet therapy drug, you increase your risk of bleeding. Bleeding is a very serious side effect. First of all, bleeding can cause hospitalization. It can cause tremendous discomfort. It can cause, in the worst case scenario, a bleed in the brain, which is extraordinarily serious. But another problem with bleeding is that when somebody bleeds, they not only stop their antiplatelet therapy drug, but they also stop their anticoagulant drug, or they stop some of their other protective drugs because they think, oh my gosh, I just bled, I need to stop all of my medicines. Unfortunately, that happens too frequently. So it's really our job to make sure that the person is on the right amount of drug without too much.